The call to the honourable member for Calwell.
Question is to the Minister for Health. How is the Albanese Labor government making it more affordable for Australians to access essential medicines through the PBS? Has the government encountered any obstacles in making medicines cheaper for Australians?
The call to the Minister for Health and Aged Care.
Thank you, Speaker, and I thank the member for Calwell for her question. I know what a passionate advocate she is, particularly for the health and dignity of older Australians in her electorate, which is why I know she was so delighted at our government's decision to give 5 million older Australians access to the latest cutting-edge shingles vaccine completely free of charge. Before the November the 1st, they were paying $560, but now they have access to the most comprehensive shingles vaccine program on the planet. Just one part, Mr Speaker, of our commitment to strengthening Medicare through cheaper medicines. Already this year, Mr Speaker, around 2 million pensioners and concession card holders have benefited from our decision last year to cut the maximum amount they pay for all their medicines by 25%, the first wave of our cheaper medicines policy. That's 2 million pensioners and concession card holders, Mr Speaker, paying up to 25% less for their medicines this year. And general patients are getting cheaper medicines too, through the biggest cut to the price of medicines in the 75-year history of the PBS on the 1st of January, the second wave of our cheaper medicines reforms. This year, Mr Speaker, general patients will have saved almost $250 million from that measure alone. And from the 1st of September, 4 million Australians were able to go to their doctor and ask for a 60-day script for around 100 common medicines for ongoing health conditions. The third wave of cheaper medicines, and the Leader of the Nationals asks how that's going. Well, already more than 600,000 60-day prescriptions have been issued for the price of a single script, saving people money, saving people time, freeing up all of those desperately needed GP consults. And that's why so many other countries have been doing this for years. It's why every doctors group, every patient group supported the government's policy. But I'm asked by the member for Calwell about obstacles, Mr Speaker. Well, 5 years ago, the former government made a deliberate decision to reject the expert advice to introduce 60-day scripts, making patients pay hundreds and hundreds of millions of dollars since that time they didn't have to pay. And only a few months ago, the Coalition showed they'd learned nothing, voting time and time again in the other place to block access to cheaper medicines for millions of Australians. Now, this is perhaps not surprising, Mr Speaker, from a party led by a man who, when he was the Health Minister, not only tried to abolish bulk billing altogether and make people pay every time they went to a doctor, not only tried to cut $50 billion from hospitals, but also tried to jack up the price of medicine by up to $5 a script.